Okay, perfect.
But if you want to join, you can join also. Okay.
Good morning to everyone on
Am
this
I?
call. Yes, we shall wait for another 2-3 minutes so that more people are in the call before
No
we
problem,
start.
no problem. That's
Yes.
fine, perfectly okay. Take your own time. I'm not in a hurry.
How's your day been, doctor? All good?
Pardon?
How's your day been?
Hello? Good.
Thank you for joining us today on a Saturday morning. We really appreciate you being here for this call. Would this be a good time to start? Yes.
Yeah, sure.
So good morning to everyone on this webinar. I'm on this Google Meet. Good morning to everybody. I'm happy all of you are here. Today we have a very insightful topic we'll be discussing, and it is especially very important for every woman to know about this. It's the uterine fibroid embolization. Even before this meeting, I had no idea about what it was. And today is going to be a very important session for most of us. And what we did not know is that 70% of the women out there around the age of 50, up to the age of 50, have this. And it can affect the lifestyle. If not, it's not deadly, but it does affect the lifestyle. It causes extremely painful menstruation. So this is something we all must learn. And I am Sumana. I'm with Medfin today, and I'll be the moderator for this session. And with us today, we have Dr. B.G. Muralidhara, who is a senior interventional radiologist specialist, and he's also the founder and owner of the Trinity Hospital, which is one of the city's most premium cardiology and interventional radiology centers. It is there for over 2 decades and it's known for the state of art infrastructure. As well as, and our doctor here, he has decades of experience with advanced minimal invasion procedures such as uterine fibroid embolization, which we will talk about today, as well as GAE, TAE, and PAE. Doctor, we are honored to have you here. Thank you so much for being here.
Thank you. It's
Yes.
my pleasure.
Yes. Do we get started, sir?
Yes.
Yes. So firstly, before we start discussing what is fibroid, what is uterine fibroid?
See, uterine fibroid is a overgrowth of the muscular tissue. It's a muscle which is present inside the uterus. Uterus is basically a muscular organ. There is muscle inside the uterus, and there are two linings, one inside and one outside. 90% of the uterus is made of muscle.
Correct.
This is an overgrowth of muscle. When the muscle will overgrow because of hormonal imbalance and because of anxiety, stress, and psychological factors, they form small swellings inside the uterus. So these are basically overgrowth of muscle cells which become a swelling and that cause disturbances. And as you said rightly in the introduction, almost 70 to 80% of the women experience fibroids in their lifetime. But majority of them will not have much any symptoms, so they will never know about it. But a large majority of patients, almost half of them, will have very, very painful periods, excessive bleeding during the periods, backache, abdominal symptoms, and severe pain. But unfortunately, many of them do not relate this backache to the fibroids. They think backache is something related to their posture, related to orthopedic problem. They never consult the proper thing. So what happens is it goes on for a long period unnoticed. And many women suffer this silently because they don't want to talk about it. Because menstruation and menstrual problems are a kind of taboo in our society.
Correct.
But it's not anymore, but that was a kind of feeling that people had and they would never openly discuss about it. And they would assume that it's a part of life and they would just accept it and live with it.
Yes, there's a lot of misunderstanding that periods is something that is supposed to be painful. So it is not really addressed. And that's the reason this is very unaware of. And I think that's
so many people
Yes, that's the
A lot
reason
of,
this
you know,
discussion is important. Yes.
yes, see, a lot of people who come to us, that story is usually minimum many years. It's never a short period. They've been suffering with this for many, many years, and only then they seek help. So the first, my first suggestion, my request to the audience who are listening to this is, please do not suffer silently with these symptoms. When you think you have anything related to something like this, you have a painful period, so you have pain during the periods, excessive bleeding, you pass clots, you have severe pain, please do not suffer silently. Please consult a doctor, get one simple ultrasound test done, and that will show fibroids very, very well. We don't need anything much beyond that. And this one simple test will help us in identifying and treating. So the first message is, please do not suffer silently because of the fibroids. This is an extremely common problem. A lot of women are facing problem. A lot of educated women, working women are suffering with this problem for a long, long time. Other day, I had a call from one of the medical professional. She herself is a nursing person, nursing superintendent working for 20 years. And she says she's fed up of this. But she said, I was always afraid of surgery. I didn't want to get a surgery done. That's why I thought I did not want to talk about it. I did not want to know about it. The moment she came to know about uterine fibroid embolization, she was overjoyed and she came and she got the procedure done. And so the biggest problem is silent suffering. Please do not suffer with this.
Correct.
This can be treated very easily with a very simple procedure, which we discuss over the next few
So,
minutes.
so before we talk about the procedure, what actually causes these fibroids?
See, as I said, fibroids are overgrowth of the muscle cell. It happens because of many reasons. It's not a single factor. It's not like one single factor and we give a magic bullet and it will be cured. No. It's because of hormonal imbalances, stress, anxiety, and over a period of time, everybody develops. As we said, 80% of the women have fibroids. So it's nothing, it's not an abnormal or it's not a rare disease. It's an extremely common problem. It's an overgrowth of the muscle cell. So it's kind of a reparative process, but it goes beyond repair and then it becomes a problem. So it's an overgrowth of the tissue because of multiple factors. Since it happens because of many reasons and over a period of many months to years, there is no simple magic bullet and there is no single reason. Since there is no single reason, we cannot give any single treatment to fix this once unless to prevent it from happening. So it's only initially people try, it's because of the hormonal imbalance and stress. And the stress is also more now because most of the women are working women. They need to have a work-life balance. That kind of work-life balance is very difficult to achieve. We live many a times in toxic culture and toxic work environment, and all this adds to this. That is why now this has become more prevalent.
Correct. And the reason this is quite not aware as much is because the symptoms are not seen for a long time. Is that the reason?
One is the symptoms are not being seen for a long time, and then it happens, develops gradually over a period of months to years. See, if something happens, you're totally normal today, and something happens abnormal, you notice it. Here, this is something that has been going on for many years. See, initially you have periods for 2 days, then 3 days, then it will become painful, then you start passing clots. All this happens for a period of time. You think that, okay, there is something wrong going with my body, maybe it's because of this, because of that. You don't really attribute a particular reason. And you silently take it as an accept as a part of the life. And as we know, during periods or any during stressful periods, that even if somebody is going through an exam stress or an interview or whatever kind of thing, it affects. And but you attribute it to the stress and you don't really give importance to this problem, and you keep on suffering silently. People start noticing it only when it becomes very severe, or sometimes they develop anemia, or they go for some other test and incidentally find that they have a huge fibroid. A fibroid is sometimes we see when they're not at all, they don't have much symptoms, but the size of fibroid, it's probably as big as uterus itself. It's occupying 90% of the space in uterus. So it can grow to a large extent before it causes any symptoms. That is another reason why people don't experience symptoms.
Also, is there any way to prevent the fibroids growing itself?
That is what I said. Since we don't even know what it causes, there is no way we can prevent it.
Correct.
Obesity is one reason, lack of exercise is another reason, sedentary lifestyle, stress, hormonal imbalance. These are all multiple things that are given. So since we don't know what really causes it, we there is no way we can prevent it because it's not just one single factor.
Correct.
We know how to treat it. We really don't know how to prevent it.
So around what age would this actually be a very issue? Like at what point of time do you actually go to a doctor and ask for a scan?
See, it's not related to the age. It's basically related to your symptoms. How severe is your bleeding? How painful is bleeding? How many days the bleeding lasts? And are you passing clots? The moment you start passing clots, that's a red flag. That means that you are bleeding too much. Normal menstrual blood is not supposed to clot. It's supposed to flow out. It starts clotting means you are bleeding much more than the body can handle. So the first red flag is clots. Second is pain. Third is severe bleeding. Fourth is anemia. If you have any of these things, anemia can cause weakness, fatigue. You feel tired easily. You're not able to concentrate on your. When you have any of these symptoms, think that it could be a fibroid and go and get a scan done, and that it shows what is the story.
Yes, and as a woman, I can say that most of these symptoms are taken quite lightly because we think this is a part of, being a woman and having periods. So to anyone out there having these symptoms, I would advise them to have a consultation once about this. And to talk about the diagnosis process, how does it go when a client comes in? So do you like suggest the scan for?
Basically, we need two tests that we done for this. Majority of the patients, just a simple ultrasound test is more than enough. But it is important to do this test with a full bladder. Your bladder should be fully filled with urine so that when you go for a scan, the uterus gets pushed up and gets properly imaged. Okay, so the important thing is please drink plenty of water, fill your bladder before you get the scan. Otherwise, what happens is many times we get scan reports which are not, the quality is not good because your bladder was not full, there was no water content, and they were not able to image the uterus properly. A simple ultrasound test will suffice in most of the patients. I would say rather 90% of the patients. In 10% of the patients, when we suspect there could be some other reason, there could be endometriosis or ovarian cyst or other things, we suggest to go for an MRI scan. MRI scan of your pelvis, that will show, that's a three-dimensional study that will completely show the fibroids with much more clarity. It will also tell us about the vascularity of the fibroid. It will tell us about the pressure symptoms on uterus, pressure symptoms on other parts of the body. We get more clarification in MRI, which is required in about 10% of the cases, in my opinion. Some people advocate MRI for most of the people, but I'm a little bit conservative. I've been practicing this field for the last 20 years. So we are used to doing with ultrasound scan, and we are more than happy with just an ultrasound scan. Okay. But if somebody wants to know more about it, an MRI scan is not out of place. With also, these two tests, we get all the information that is required. We don't need anything beyond this.
Correct. Also, while I was reading up a little bit, fibroids, they come in, the size, as you said, is important, as well as where the fibroids are growing, like whether it's inside the uterus or on the walls. So could you just brief a little bit about that?
See, there are basically 4 locations where the fibroids are normally seen. Commonest location is inside the wall, because that's where the muscle is, it grows inside. We call an intramural fibroid in medical terms. That is within the wall of the uterus. Okay, it can come very close to the internal wall, then it becomes submucosal. It can go outside and touch the outside wall, then it becomes subserosal. Sometimes it can enter the uterine cavity itself, the space itself. That is intracavity. Sometimes it goes outside the wall. That becomes pedunculated fibroid. But basically, these are the 4 locations: intramural, subserosal, submucosal, pedunculated, or outer. But the important thing, the beauty of the procedure, with the embolization procedure, irrespective of the location of the fibroids, irrespective of the number of the fibroids, irrespective of the size of the fibroids, this one treatment will fix all of them. It is not that we have to do different treatment for different fibroids. For all of them, one point solution is uterine fibroid embolization. It treats all of them. It treats all of them in one go.
Correct. So, could you talk about the procedure itself?
See, uterine fibroid embolization is a very simple procedure. It's a minimally invasive procedure done under local anesthesia. In this procedure, there is no anesthesia given. There is no surgery done, no cutting, no stitching, no scar, no blood loss. All the problems of surgery are taken out in one go. It's a simple, minimally invasive procedure done by a pinhole in your wrist. Through the wrist, we pass a small plastic catheter into your fibroid artery, which is a branch of the uterine artery. Once we identify the fibroid artery, which is abnormal, which is giving blood supply, and because of this excessive blood supply, this excessive growth of the muscle cells are happening. So this is all because of the excessive blood supply. When we reduce the blood supply, the fibroids die, literally die. So what we do is we put particles and medicines into this uterine fibroid artery, and we knock off the blood supply more than 90%. When we knock off the blood supply by more than 90%, the fibroid literally dies, literally shrinks in size. If from a solid mass of muscle, it becomes a soft swelling with a fluid content, and that will slowly become small, degenerate, and it will get passed away during the menstrual period. So a hard ball mass becomes a very soft tissue. Once the density itself comes down, the symptoms are less. And then it also shrinks in size. And if it is a small fibroid, it will even completely disappear completely. So even large fibroids shrink up to 70% of their size by volume. So if they're 100 centimeter, 100 millimeter by volume, it will become 30 millimeters or 20 millimeters over a period of time. And we see this shrinkage maximum up to 6 months. But then the shrinkage persists for the rest of the life. So it's not just you do treatment and then it will start growing again. No. Once we do this procedure, it will decrease. Maximum we see by 6 months, but it continues to decrease even afterwards and probably disappears in most of the places. And once the embolization procedure done, it does not recur for 8 to 10 years. So it's a long-lasting procedure with established results and with very good profile. It is not just we do something and then after 3 months they're back with symptoms. No,
So with
this is a permanent.
so with very less surgery, just by the small procedure, you're able to prevent years of pain.
Yes,
So
yeah,
is this a
absolutely.
surgery done by a gynecologist, or you need
Unfortunately, this is not done by gynecologists.
okay.
This is done by interventional radiologists, vascular surgeons, and some cardiologists like me who have been trained, who are trained 30 years ago. So, second thing is, please, people should note that this is not something new. This is not something that has happened yesterday or today. This has been there for more than 25 years. I myself have been doing this procedure for 20 years. We have documented results in lakhs of patients, literature, who have got follow-up up to 10 years. That is why we say that up to 10 years it does not come back. We are very sure about it. It is not our imagination. It is a very well-established procedure. In China, it is done by gynecologists. So there are gynecologists who have personal experience of more than 3,000, 5,000 patients where they have done UFE. In India, unfortunately, it is not done by gynecologists. It is done by interventional radiologists and specialists like us who have been trained in this field for a long time. We have a team. Our team consists of interventional radiologists, vascular surgeon, and myself, who is an interventional cardiologist. So we form the core team, and all our team members are trained in this procedure.
Also, is this procedure advisable for every woman, or is there like any kind of restrictions or any patients who cannot undergo this process?
There is absolutely no contraindication. Any woman can undergo this procedure. We have no difficulty in treating anybody, obese patient or otherwise, or any other morbidity. Even patients who have got hypertension or diabetes, who are high risk for surgery, hysterectomy surgery, they can go through this procedure because this is a minimally invasive procedure where there is no cutting, no stitching, no scar, and no risk of infection. And also in patients who have got blood loss, anemia, hysterectomy surgery cannot be done because it carries a high risk. Even patients with a lot of people receive hemoglobin of 7, 8. In those patients also, this procedure can be safely done because, as I said in my intro, there is no blood loss in this procedure. All we are putting is a pinhole. So that pinhole, it will be closed immediately after the procedure. So there is no stitching, no blood loss, no complications. It can be done in anybody, any age,
I think that is,
and can be
yeah,
if required after 10 years.
correct. I think that is comforting for a lot of women to know that this is a very safe procedure. And so how would like a day of this procedure be? Would it could they be on their feet the next day itself, or do they need to like take rest for a while? How would their lifestyle be around the procedure?
Typically, we ask the patient to come on the day of procedure early in the morning by about 9 o'clock. We ask them not to have any food for the previous 4 hours. We need the patient to be in a fasting state for 4 hours. They should not have any food for 4 hours. And typically, when they come, we put an IV cannula in the hand and we put them through the cannula. We give them some medicines to sedate them, give them some pain relief. Then we take them for the procedure, and the procedure takes about an hour or hour and a half maximum. It's done by, as I said, by a pinhole in the wrist. It's exactly like a glucose cannula, little bigger than the glucose cannula, that's all. Through that cannula, we do the procedure. And before we put the needle cannula, we numb the area so that they don't feel anything. The entire procedure, when we pass the catheter, when we reach the artery, we put the particles, the entire procedure is totally painless. Patient does not feel anything. And it is done under fluoroscopic guidance in an angio suite, so that it's a precision guided medicine. We go exactly into the uterine fibroid artery, we identify it, and we treat only there. It doesn't affect any other part of the body.
What
So there is
about
no
does it affect fertilization? Because I think that is one of the bigger concerns, as well as any correlation with pregnancy. Can pregnant women also undergo this?
the pregnant woman cannot undergo this procedure because it will be done under fluoroscopic guidance. So if there is already pregnant, we don't suggest this procedure during the pregnancy. It is done only after the pregnancy if it is required. Most of the pregnant women will not have a very big fibroid. If they have a very big fibroid, they will not be able to conceive it because there won't be any space for the fetus to grow. One of the causes of miscarriage is fibroids. When they lose the fetus, they come and find out and then they find a fibroid. So it's usually treated before the pregnancy or after the pregnancy, never during the pregnancy. And as far as the fertility is concerned, there is no adverse effect because of the fibroid embolization. But it no way affects the fertility. And many people who want to save the uterus for the baby, and that's why they cannot undergo a surgery and they cannot afford to lose the uterus, they come for this procedure. After this procedure, their fertility rate remains the same as what it was before or even better. I have in my own experience, many of my patients who have undergone this treatment have conceived, have had a normal baby and they are doing it.
That is wonderful.
The best uterus saving procedure known to mankind. If a lady wants to save the uterus for future family, this is the best procedure and for probably the only procedure.
And sorry. Yeah, so another a few patients who have undergone this small procedure, they have experienced post-embolization syndrome. So it is about 20% of the women who experience it, but it is
Yes,
also
yes.
something people think about before. So could you like brief us
See,
about that?
what is the alternative for this procedure? The alternative for this procedure is an hysterectomy surgery. When you go through hysterectomy surgery, you have a big scar, you have pain, you have severe abdominal pain, severe backache for 3 to 5 days or even up to 10 days. For the scar to heal, it will 10 days. So during that period, you have severe pain, you are not mobile, you are not moving around, you are not doing anything. So this is what happens post-hysterectomy. In post-embolization syndrome, some people, as I said, some 10 to 20% of people, depending upon their pain threshold, they have pelvic pain, abdominal pain, they will have backache, they will have urinary symptoms, they feel like peeing more often because of the pressure on the bladder. Sometimes they have constipation, they're not able to pass the motion because of pressure on the rectum. So this all forms a part of embolization syndrome. Some people also have excessive nausea, vomiting, and they're not able to take food. This is seen about 15 to 20% of the patients. This is like any other post-operative symptoms that we see in people. For a period of 1 to 2 days, it resolves. It is treated by simple painkillers, simple medications to stop vomiting, and for them to help pass motion. And once all that done, it is taken care, it is clear. It's basically because of as I said, once we do embolization, the fibroids literally die. It is the crying of the dying fibroid. There's nothing that we can do about it. And second thing is, if it is a large fibroid, huge fibroid, the post-embolization syndrome risk is more. It also depends upon the threshold of the woman. Some people are strong and they're mentally prepared. They don't feel much. Some people say, I didn't feel a thing. Whereas some people say, oh, I had so much of pain, I had so much. So it is known to happen in some people, which can be managed with simple medicines, and it's a period of 2 to 3 years, 2 to 3 days. It's a self-limiting problem. It is not something that is chronic. It has no serious side effects. That we need to handle the patient, handhold the patient during that 1 to 3 days, which we do it. And that's why what we do is post-procedure, we put you on what is called as a PCA, patient-controlled analgesia. We give you a machine which is connected to your vein, and then there is a medicine, analgesic medicine. Depending upon your pain threshold, you can press the button and you get the medicine immediately so that you don't have to suffer the pain. Some people say, I don't want that at all. And some people say, no, I need it, and they use it. So we give the option to you, and you want to take care of your pain, it can be taken, you can do it, you can control yourself. You don't even have to ask somebody or wait for the nurse or the physician.
So should the patient be in the hospital for a day or two?
We normally keep the hospital patient in the hospital for a day, mainly to take care of the embolization syndrome if it happens. If it doesn't happen, we discharge the patient in the next day morning. It's a 1 day procedure. The procedure takes about 1.5 hours a day, and patient stays in the hospital for a single day.
So for any woman watching this, what should their first step be? What should their could you address the woman, like who should probably take this up more seriously and book a consultation right away?
See, as I told you, please do not suffer silently with these symptoms. There is a simple procedure available which can fix the problem. It is not a surgical procedure at all. It's a minimally invasive procedure, which is a great alternative to the surgery and works very well. So anybody who causes clots during periods, first sign. Second, excessive pain and excessive bleeding during periods. Number 3, somebody who has anemia. These are the 3 classical indications that they should consult us. They should seek our opinion and see if we can help them to relieve their symptoms and their problem.
And for everyone watching this, at the end of the discussion, you will be given a chance to ask questions yourself and clarify every doubt you're having, as well as the link of the video, and on our Medfin WhatsApp group, you will get a link to book your own personalized or one-on-one consultation. So I would recommend you all to stay till the end of the call. And how important it is for a woman to have both a gynecologist and an interventional radiologist. So.
See, most of the time this can be managed with the interventional radiologist, and we do the procedure, and the procedure is self-limiting, except for post-embolization, which we discussed in detail, which happen in about 10 to 20% of the people. After the procedure, the first period which they may have little bit excessive bleeding, or they may have less bleeding. After 2 to 3 cycles, the periods become completely normal. They will not have pain. They will not have excessive bleeding. The anemia will improve. And then if it is required, we normally do a scan at the end of 3 to 6 months to see what has happened to the fibroids to compare with the pre-procedural fibroid. As we have seen in our results, 70% reduction in the size is seen in 70% of the patients. In 10 to 20% of the patients, the reduction will be a little less. But most of the people, 85 to 95% of the patients, they feel symptomatic improvement. The painful periods will disappear. The clot passing will disappear, excessive bleeding will disappear in 95% of the patients. So they will not require any further care. After 6 months, if somebody wants to conceive, they can conceive also. And then whatever further follow-up they want to do with the gynecologist, they can go back and they can do with the gynecologist or physician. We are not in any way interfering with the further treatment of either pregnancy or any other gynec treatment that are due for other indications.
Okay. Thank you so much, doctor. So we have a few questions from our from the live, which our audience have been asking. So someone says, my wife already had one surgery for fibroids before. Can she still consider a UFE?
Definitely, yes. This is a common problem we are seeing in most of the patients. They undergo a surgery, they remove one fibroid. After a few years, they realize that there are 4 more left behind. The small, tiny ones have grown over a period of time. Going for second surgery is always very risky, unwanted, and unwarranted. Even somebody who has had a procedure, a surgical procedure earlier done, we can do UFE, and UFE works very well in this set of population. with extremely good results.
That's wonderful. Does the procedure affect hormones?
Absolutely not. See, hormones are produced by ovaries, which are sitting next to the uterus, and they have got their own blood supply. Ovaries get blood supply from ovarian artery. Uterus gets blood supply from uterine artery. Fibroid gets supply from uterine fibroid artery. That's why I told you during my intro that this is a precision guided medicine. We identify the artery which is supplying to the fibroid, and we put these particles or medicine only into the fibroid artery, not into the ovarian artery. So there is no risk of any hormonal imbalances, no risk of any complication if the procedure is done executed under precision, under fluoroscopy, precisely under fluoroscopic guidance. So such complications are very rare.
Yes, thank you, doctor. Another question we have
Thank
is,
you.
do fibroids shrink on their own without the procedure? Is there any way?
As I said, we don't know why it happens in the first place.
Hmm.
So we cannot assume that it will shrink on its own without a reason. So unless there is a treatment, I think it is difficult. So unless they see, there are three things that are known to. One is hysterectomy surgery, which is a radical procedure, which we don't want to talk about it. Second is uterine fibroid embolization, which is a minimally procedure. Some people are also treated with hormones and tablets with progesterone and estrone, various combinations, and that will help to reduce. Without any treatment, expecting fibroid to disappear on its own is a wishful thinking. I don't think they will regress. They'll regress only after the age of 50 years. Maybe once the woman attains menopause, then
Mhm.
it will come down. Not till the age of 50 or not till the attain menopause.
Correct, correct. Also, doctor, will UFE affect the menstruation cycle and the timings?
As I said, the first cycle may be delayed a bit
Hmm.
or might happen early, or there may be some excessive flow or excessive things causing clots in the first cycle. After second and third cycle, there is absolutely no difference. In fact, it will make your periods regular,
Hmm.
less painful, and less bleeding. It sets your cycle perfectly. I had a patient whom I treated recently, about 6 months ago. She came back and told me she is 36 years old now. For the first time in her life, okay, ever since she had periods, she had normal periods for the last 3 months. She said, I never thought I'm going to have a normal periods in my life. I was so fed up and now I feel so normal. She literally thanked me. She said, you made my life so much better. So cycles become regular. It no longer a pain point for you.
Yes. Uh, Actually, doctor, I have a personal question. Also, a lot of these symptoms are very similar to PCOD and PCOS. So there was a time when I thought my hormonal imbalance and my irregular periods was because of that. But after getting those tests, it was I don't have PCOD or PCOS. So could this be one of a possible reasons for
Yes,
similar
definitely possible
symptoms?
because PCOD and fibroids occur together in a lot of people. Almost 20 to 30% of the people have both. They have
Correct.
PCOD and they also have fibroids. And they get confused between which is causing more. So most of the time, the PCOD can be treated by diet, by regular exercise, losing weight, and we also have the medicines like metformin, which helps the PCOD and helps you to regularize the thing. But those things somehow do not help the fibroids. So fibroids will continue to grow. So in those people, take the treatment for PCOD and the PCOD symptoms will disappear.
Correct.
And for the excessive bleeding and painful cycles, you have to go through UFE for treatment. So these are two complementary things. They're not competitive things.
Correct. So, sir, after 10 years, would the fibroids like develop again, or would it cause further complications after certain years after the procedure?
As I said, they continue to decrease in size up to 10 years because we have follow-up now available up to 10 years. What happens after 10 years? It does not increase in size. There are no reported complications.
Okay. Thank you, doctor. Also, do you have any input for people that have this issue? there's a participant who has submucous fibroids in the wall and bulky uterus. Would this treatment work for them as well?
It will definitely work for her. As I said in the thing, whether it is submucosal, subserosal, pedunculated, intramural, wherever it works. And if they have bulky uterus, again, the bulky uterus is because of excessive blood supply. When we treat this, the amount of blood circulation to the uterus also will be reduced, it helps. And some people also what is called as adenomyosis or endometriosis. They have thickened wall of the uterus with excess, that internal lining is become enlarged and they have excessive bleeding and painful bleeding. In adenomyosis also, it works extremely well. So for uterus, fibroid uterus, bulky uterus, and for endometriosis, for all these three diseases, the single procedure works.
This also works for people who have a fibroid near their cervix.
Yes.
Okay. And also, there's a participant whose wife has had a C-section before. So
Everyone.
do they also are they also eligible for this procedure?
Yes, yes. This previous section, C-section is no contraindication. We can do EFE procedure in those people as well.
Wonderful. So, any takeaways, sir, from our discussion so far?
Well, as I
And
said in my talk,
and your
simple thing
advice
is
and suggestions to
my,
everyone
my simple
watching.
advice.
Yeah.
My simple advice to the women folk is, please, you are already going through a lot of issues. Do not suffer from do not suffer from this problem silently and suffer the symptoms. There is a simple procedure which can fix and which can make you feel a lot better. Your quality of life will improve and you can concentrate on other things in life rather than suffering from this during every month for 3 to 5 days. So that is my first message. Let us stop this silent suffering of women. And also, it's an extremely common problem. That is what we need to understand. And the third thing is, it affects a working woman. It affects people in the working lifetime and in their prime time, and that affects the quality of life. So it's very important that we make you better, feel better, so that you can concentrate on your lifestyle improve and your productivity improves. So one is, please do not suffer silently with this problem, and this problem can be done to all the women, all the irrespective of the age, irrespective of the location, irrespective of the previous surgery. So this is universally applicable, and all the women can take the benefit of this procedure.
Doctor, thank you so much for this wonderful discussion. It was very insightful for every woman on this and everyone actually, for everyone who has people suffering around them, because periods is something which every woman goes through every month and it's not easy. So thank you so much, doctor. We had a very insightful conversation about uterine fibroids and the procedure as well. We know that now this is something which is not a one size fit all. So I would, for everyone going through anything, like doctor said, please, please be free to consult a doctor, and you can book a free consultation, and the link is in the description as well as in the Medfin WhatsApp group you're all a part of. And also, yeah, please be free to book a consultation right away using the link and review. You also get to review your scans with experts and make a decision based on that with complete clarity so that you feel confident with what you're going forward. And thank you so much for Medfin for hosting this webinar, and thank you, doctor, for taking your time and enlightening us with this, because I think it is very important for all of us to know more about our body and how we can improve the quality of life with something very simple which we were not aware of. So thank you so much for this session.
Thank you. Thank you. Bye bye.
Thank you. Thank you.